Let me explain. When your doctor or nurse wraps that cuff around your arm and squeezes tight, it's measuring the pressure of blood pushing against your artery walls. Blood pressure isn't constant. It pulses with every heartbeat. That's why you get two numbers. The top number, called systolic pressure, measures the maximum force when your heart contracts and pushes blood into your arteries. Think of it as a wave crashing against the shore. The bottom number, the diastolic pressure, measures the minimum pressure when your heart relaxes between beats. It's the calm between the waves. So if your reading is 150/90, it means the peak pressure is 150 and the resting pressure is 90. For decades, doctors treated both numbers equally. If either was elevated, you had high blood pressure. But as research followed millions of people for decades, a clear pattern emerged, one that becomes sharper the older you get. Let me tell you about two patients to help you understand why this matters. Margaret was 73. Her blood pressure that day was 165/70. She was thrilled because her bottom number was perfect. "Dr. Jocelyn," she said, "I've worked so hard to keep the bottom number under 80. My top number is a little high, but I was told not to worry." 6 months later, Margaret suffered a massive stroke. Left side paralyzed, speech slurred. The vibrant, independent woman now depended on her daughter for every basic need. The cause? Years of elevated systolic pressure quietly damaging her arteries, while everyone celebrated her great diastolic number. Robert was 68. His reading was 128/95. He worried constantly. He'd read online that diastolic pressure is the true killer. His heart, however, was strong. Tests showed minimal plaque. His diastolic number needed attention, yes, but his risk was nowhere near what he feared. Two patients, two different patterns, and two completely different outcomes. This is why the question you came here to answer matters so much. Which number is more dangerous, systolic or diastolic? Here's the key. The answer isn't the same for everyone. At 30, it might be different than at 70, but for most people over 60, the research is crystal clear. Systolic blood pressure, the top number, is the one that predicts strokes, heart attacks, heart failure, kidney damage, and even cognitive decline. And it's the number that quietly rises as arteries stiffen with age. It's the one that needs your attention, the one that needs control, the one that could literally save your life if addressed today. Now that you understand why the top number matters so much, let's dive deeper into what's happening inside your body. Your arteries aren't rigid pipes. They're elastic tubes that expand slightly with every heartbeat and then recoil. This elasticity acts like a shock absorber, smoothing out the pressure and protecting your heart, brain, kidneys, and eyes. When you're young, your arteries stretch easily, keeping systolic pressure relatively low and diastolic pressure higher. But as you age, those elastic fibers break down. They're replaced with stiffer tissue, calcium deposits build up, and plaques can form. Your arteries become less like flexible rubber bands and more like stiff tubes. When your heart contracts and pushes blood into these stiff arteries, the pressure rises sharply. That's why systolic numbers climb with age. During the resting phase, these stiff arteries don't recoil as well, so diastolic numbers may stay the same or even drop. This is called isolated systolic hypertension, and it's extremely common in people over 60. For years, doctors weren't sure what to do about it. Some thought, well, if the bottom number is normal, maybe it's just aging. We now know that's dangerously wrong. Ignoring a high systolic number is like letting a crack in a dam go untreated. It only grows worse over time. Elevated systolic pressure isn't just a number, it's actively causing damage. Every heartbeat sends a wave that pounds your organs. Your brain, kidneys, and heart all suffer. Tiny blood vessels in the brain can develop microaneurysms or become blocked, leading to silent strokes or even major ones. Repeated small injuries over the years can cause vascular dementia, memory loss, and confusion. Some conditions we call Alzheimer's are actually caused by years of uncontrolled high systolic pressure. Your heart works harder too. The muscle thickens in response to constant pressure, making it stiff and less efficient. This can eventually lead to heart failure, not from one heart attack, but from years of relentless strain. Your kidneys, with millions of delicate filtering units, also take a hit. Damaged vessels reduce kidney function, which worsens hypertension, a vicious cycle that can end in dialysis if untreated. Even if your diastolic pressure is low, don't assume you're safe. In older adults with stiff arteries, systolic may be high while diastolic drops below 60, sometimes below 50. This creates a wide pulse pressure, which is its own risk factor. Low diastolic pressure can actually reduce blood flow to your heart during the resting phase, leading to chest pain or angina, despite open coronary arteries. The ideal situation is to have both numbers well controlled. But if we have to prioritize, the evidence is clear. Systolic, the top number, is the one to focus on. Multiple massive studies back this up. The Framingham Heart Study, MRFIT, and countless others involving millions of people all show the same pattern. After 60, systolic pressure predicts heart attacks and strokes far better than diastolic. In fact, some research shows it's 2 to 3 times more predictive. If you're over 60, your top number is the real threat. Controlling it can dramatically reduce your risk of stroke, heart attack, and even cognitive decline. Understanding this isn't just academic, it's life-saving. Once you realize how systolic pressure damages your organs silently, you see why monitoring and controlling it matters more than ever. Every beat, every day, it's working against you if left unchecked. But the good news is, there's plenty you can do. Now that you understand why systolic pressure is the real danger, the next question is, what can you do about it? The answer involves both lifestyle changes and, for many seniors, medication. Lifestyle changes are the foundation. First, sodium reduction is critical. Most Americans consume more than 3,400 milligrams of sodium daily. For seniors with high blood pressure, the recommendation is 1,500 to 2,000 milliliters maximum. Cutting processed foods, reading labels carefully, and avoiding added salt at the table can lower systolic pressure by 5 to 10 points. That alone can make a huge difference and sometimes even reduce the need for medication. Second, weight management matters. If you're overweight, losing even a few pounds can have a measurable impact. On average, each kilogram, about 2.2 pounds, loss lowers systolic pressure by roughly 1 point. Lose 10 pounds, and you can expect your top number to drop about 10 points. Combine this with sodium reduction, and you could see a 15 to 20 point drop without ever touching medication. Third, regular aerobic exercise is essential. Walking, swimming, cycling, anything that raises your heart rate moderately for at least 30 minutes most days of the week helps. Exercise improves blood vessel elasticity over time, strengthens the heart, and lowers blood pressure. It's not just about losing weight. Exercise is medicine in its purest form. Fourth, limit alcohol. Excessive drinking can spike systolic pressure. For men, no more than 2 drinks per day, and for women, no more than 1. Fifth, stress management is crucial. Chronic stress increases cortisol and adrenaline, both of which raise blood pressure. Meditation, deep breathing, yoga, whatever works for you, should be a daily habit. These lifestyle adjustments are powerful, but for many people over 60, especially with systolic numbers above 140 or 150, lifestyle alone isn't enough. Medication is often necessary, and it's not a sign of failure. In fact, for seniors with stiff arteries and elevated top numbers, blood pressure medication can be life-saving. There are many classes of blood pressure medications: diuretics, ACE inhibitors, ARBs, calcium channel blockers, beta blockers. Each works differently. Some people need 2 or 3 medications to reach their target systolic pressure. That's normal. Your doctor will choose medications based on your other conditions. If you have diabetes, some drugs protect your kidneys. If you have heart failure, others help your heart pump more effectively. It's about finding the right combination for your body while minimizing side effects. Once you start medication, monitoring becomes essential. Don't rely only on the doctor's office every few months. Get a reliable home blood pressure monitor. Check in the morning and evening for the first week after any new prescription or dose change. Once stable, weekly monitoring is enough. Keep a log. Bring it to your appointments. Home monitoring helps detect white coat hypertension, where pressure spikes in the office but is normal at home, and masked hypertension, where office readings are normal but home readings are high. Both scenarios are common in seniors and have major implications for treatment. Many people say, "I feel fine. Why treat it?" The truth is, high systolic pressure often causes no symptoms until a catastrophic event occurs. The first sign of years of uncontrolled top numbers may be a stroke or heart attack. That's why hypertension is called the silent killer. It works quietly, year after year, damaging arteries, the heart, kidneys, and brain. Waiting for symptoms is waiting too long. Let's talk about guidelines and targets for seniors, because knowing your numbers is only the first step. The American College of Cardiology and the American Heart Association updated their blood pressure guidelines in 2017. They lowered the definition of hypertension to 130/80. That means if your systolic number is 130 or higher, or your diastolic is 80 or higher, you have high blood pressure. But here's the key for people over 60. Controlling the top number, systolic, is the primary goal. For most healthy older adults, the target is below 130. Some studies suggest even lower, like under 120, can dramatically reduce the risk of heart attack, stroke, and death. This comes from research like the SPRINT trial, which showed major improvements with intensive systolic control. However, for frail seniors, especially those over 80 with multiple medical conditions, slightly higher targets may be safer. You don't want to drop blood pressure too low too quickly, because that can increase the risk of dizziness, falls, or other complications. That's why personalized care is critical. Your doctor should work with you to find the safest, most effective target for your individual health. Now, here's the reality. If your systolic pressure is above 130, you need to act. Don't let anyone dismiss it because your bottom number looks fine. Isolated systolic hypertension in older adults is dangerous and requires treatment. Start with lifestyle changes as we discussed. Reduce sodium, maintain a healthy weight, exercise regularly, limit alcohol, manage stress. These are foundational habits that help your top number and overall health. If medication is prescribed, consistency is everything. Take your pills exactly as directed. Set reminders, use a pill organizer, make it part of your daily routine. Missing doses causes your pressure to swing, which can be worse than mild, steady elevation. And never stop or change medication without consulting your doctor. Sudden discontinuation can trigger dangerous spikes. If side effects appear, call your doctor. There are always alternative medications or combinations that can work better for you. Home monitoring is essential. A quality blood pressure monitor lets you check morning and evening readings, track trends, and detect hidden patterns. White coat hypertension, pressure rising only at the doctor's office, can give a false sense of danger, while masked hypertension, pressure rising only at home, can give a false sense of safety. Keeping accurate records empowers both you and your doctor to make the best decisions. Don't fall for myths that high blood pressure is a normal part of aging and should be left untreated. Studies prove the opposite. Even in people over 80, controlling systolic pressure reduces strokes by around 30% and overall death risk by more than 20%. Blood pressure control doesn't harm seniors, it protects them. And remember, high systolic pressure is often silent. Feeling fine doesn't mean your heart, brain, and kidneys aren't being damaged day after day. By understanding your targets, taking action, and working closely with your doctor, you can prevent devastating events before they happen. Every effort you make, monitoring, lifestyle changes, medication adherence, directly protects your heart, your brain, and your independence. Let's bring everything together. Think back to Margaret, the patient whose high systolic pressure went untreated. She was independent, active, full of life, and then one stroke changed everything. Her bottom number looked fine, so everyone assumed she was safe. But her top number, the dangerous number, was silently destroying her arteries. This is not an isolated story. Thousands of seniors are walking around today with the same pattern, unaware of the risk. The good news is, now you know. After age 60, it's the systolic number, the top number, that predicts your cardiovascular future. It's the number you need to watch closely and control proactively. Your heart, your brain, your kidneys, and your overall quality of life depend on it. Every beat matters. Every spike in systolic pressure is a stress on your organs, but the right combination of lifestyle changes and medication can stop the damage in its tracks. Know your numbers. Make sure you're checking regularly at home. Track trends, not just individual readings. Make sure your doctor knows about isolated systolic hypertension if your top number is high, but your bottom number seems fine. Don't let assumptions or myths delay treatment. Lifestyle changes remain the foundation. Reduce sodium, maintain a healthy weight, exercise consistently, limit alcohol, and manage stress. These habits aren't optional. They amplify the effects of medication, improve your heart's efficiency, protect your brain, and strengthen your arteries over time. Medication, when needed, isn't a failure. It's life-saving. Take it consistently. Communicate with your doctor. Adjust safely if side effects appear. Your commitment and your doctor's guidance together create a plan that can literally prevent stroke, heart attack, heart failure, kidney disease, and even cognitive decline. Monitor at home. Be an active partner in your care. Don't wait for symptoms. They may never appear until it's too late. Remember, hypertension is the silent killer. Feeling fine doesn't mean you're safe. Chronic high systolic pressure works quietly, damaging your organs year after year. Acting now, while you're strong and independent, is the best investment in your future. Your life, your independence, and your ability to enjoy your golden years depend on it. This isn't about fear. It's about control, empowerment, and taking practical steps that have proven results. Every month, every week, every day you manage your systolic pressure, you're protecting yourself from events that could change your life forever. Finally, stay engaged with your health. Regular checkups, consistent monitoring, and lifestyle adjustments are a lifelong commitment. Don't wait for a warning sign. Act now. Talk to your doctor about your top number, follow the guidelines, implement these changes, and take your medications as prescribed. Your heart has been beating faithfully for decades. It deserves your care. Don't let the dangerous top number go unnoticed. Control it, and you control your health and your future.